It's now time for Ask the Expert. November is Lung Cancer Awareness Month, and we are talking about the importance of keeping your lungs healthy.
Yes, we're going to take a deep breath. Joining us live this afternoon is Dr. Antony Ruggeri, an oncologist with Aurora Healthcare. Our lungs allow us to do just about everything. I like to run, swim, bike. You got to have some good lungs. So, but the impact of smoking is the worst thing, right?
It really is. I mean, it's huge, Charles. I mean, about 160,000 people die every year in the US from lung cancer. And to put that in perspective, that's more than the next 3 cancers combined. Yeah. So a woman has a much higher risk of dying of lung cancer than breast cancer.
Really?
And if you combine breast cancer, colon cancer, and prostate cancer, the deaths from those still doesn't add up to the number of people who die from lung cancer every year. So it's a huge problem.
I'm also concerned about secondhand smoke and how that plays a part in lung cancer.
I know. I mean, I think that's something that's greatly overlooked. You know, I hear a lot of people saying, well, you can still get lung cancer if you're a non-smoker, which is true. You know, 80 to 90% of lung cancer is associated with smoking, but the rest is other risks, and that includes the secondhand smoke. Yeah.
So what are some of the more common problems associated with either smoking or signs or symptoms that somebody might have lung problems?
So the first thing is the cancer, right? So you've got the lung cancer, but then everywhere the smoke goes. So you've got mouth cancers, tongue cancers, throat cancers, esophageal cancers. Then it gets absorbed into the blood, goes through the kidney, increases your risk of kidney cancer, and ends up in your urine and increases your risk of bladder cancer. Today, the chairman of the NCI came out and said that if we got rid of tobacco, the number of deaths from cancer would drop by 1/3.
Oh my.
So we're all looking for a cure for cancer. We could take a huge bite out of it by just getting rid of the cancer. And there is some good news though, because the rates of smoking has dropped dramatically. So today that came out as well. So 2017, about 14% of Americans smoke. Compared to 1960, it was about 40–50% of smoking.
When it looked popular, sexy to do so. But we have just a few seconds left. Can you tell us what kind of screening, who should get screened?
Yeah, so anybody who's over the age of 55 and has a significant smoking history, so that's usually about a pack a day for about 30 years. So if you've been smoking since you're about your 20s and you're about 50, you should go for screening, and it reduces the risk of dying from cancer. And is available, paid for by most insurances.
Thank you so much.
Thanks for being here.